Afternoon, everyone. Welcome to another This Veteran's Opinion. I found another article. This one's out of the Stars and Stripes from the VA Secretary. We're at a critical moment for shaping and securing veterans' health care. It was done by Linda F. Hershey in the Stars and Stripes on April 11th, 2024. Washington, the $369 billion spending plan that the Department of Veterans Affairs proposes for fiscal year 2025 is a maintenance budget that tightens the workforce and pulls back on construction but continues to prioritize disability and health care benefits for veterans. The VA Secretary Denis McDonough said Thursday. Testifying to an oversight hearing of the House Committee on Veterans Affairs, McDonough offered an overview of the 2025 budget, which is 10% higher than 2024. This budget allows for us to hire and retain the best health care providers for our veterans and will continue, he said. Nearly 500,000 veterans have enrolled in the VA health care in the past 12 months under the PACT Act, which McDonough said that has changed the healthcare landscape for the agency. The Sergeant First Class Heath Robinson, honoring our promise to address Comprehensive Toxic Act, or PACT Act, represents the largest expansion of veterans' benefits in a generation, he said. We're at a critical moment for shaping and securing veteran health care for the future. The goal is to bring as many vets as possible into our care. The PACT Act, which became law in August of 2022, provides VA health care and benefits to veterans who developed a medical condition after exposure to burn pits, radiation, herbicides, and other hazards during military service. About 1.5 million claims for toxic exposure have been filed, with more than 694,000 veterans and survivors awarded benefits. But Representative Mike Bost, Republican from Illinois, the committee chairman, questioned whether sending on PACT Act benefits is taking away from basic VA functions. We need to have a serious conversation on how the VA is managing taxpayer dollars. New hiring is cut back or frozen. The healthcare workforce is shrinking and construction has flatlined to only 2 major projects, he said. This is the opposite of what Congress intended. I want effective programs and realistic estimates, Bost said. It appears that the VA is shifting dollars from regular VA expenses to the Toxic Exposure Fund, which compensates disabled veterans under the PACT Act. The fund projected to provide $24.5 billion in benefits in 2025 and up to $4 billion from this year. McDonough said the planned reduction for the 10,000 full-time workers follows 2 years of robust hiring that enabled the VA to meet greater demands for care during the coronavirus pandemic and hire technicians to process a surge in disability claims under the PACT Act. After having the best hiring year in 30 years last year, we are well positioned to provide care. This budget makes hard choices, but we put them out there for you to see, he said. The Veterans Health Administration hired more than 62,000 healthcare workers in 2023. The VA employs about 400,000 workers. McDonough said the focus will now be on retaining doctors, nurses, and other frontline healthcare workers, as well as filling long-term vacancy at VA health facilities where there are shortage of specific workers. He also pointed to a continued focus in the 2025 budget on addressing veterans' suicide and easing homelessness. More than $3.2 billion is proposed to fund suicide prevention programs and treatments in the addition to the overall $17.1 billion budget for funding mental health care services. The 2025 budget also provides $3.2 billion for programs that provide housing and other assistance to homeless veterans. If there is any links or anything, I will post them. I ask everyone, please watch the video to the end. If this helped anyone or gave them some good advice, please share with our fellow veterans. And remember, like, share, and if we don't help each other, no one else will.